Lloydminster is the only place in Canada where two provinces foot the bill for one city's healthcare. But how that money is spent is pretty hard to trace.
The Prairie North Health Region is responsible for drafting a budget for Alberta Health. Alberta then pays Saskatchewan Health its portion of the pie.
At the present time, it is a real challenge measuring, what bang are we getting for that buck.
An issue with finding out just how much each province should pay links back to getting the right data to truly represent the amount of people Lloydminster serves.
I will guarantee you we are serving not less than a population of 100 to 120,000 people. Are we getting the resources for that?
If we're looking at it as a, say 70,000 base, in actuality it's well over 100,000. You're naturally going to result in shortfall in funding.
There has to be an easy way of accountability to make sure that the taxpayer is getting their dollars worth.
And accountability is hard to come by, both for spending and services. But a health summit could change all that. A meeting is being proposed that would include politicians and health providers from both sides of the border, tackling everything from accountability to efficiency and access.
We're fully supportive of the health summit.
There has to be some follow-through of this health summit.
Most are on board with the idea of gathering top health officials in the city.
I don't want to see it become a political football.
The only one on the fence, Lloydminster MLA Tim McMillan.
If a summit is being put forward as a political solution, I don't think that will be as successful as identifying issues and working on those issues and solving them.
And other local and provincial politicians agree. Simply bringing together top officials with no pre-planning would waste everyone's time.
If you can provide solutional information when you bring decision makers together, you will get a quicker decision.
It involves basically identifying, okay, what are our top 5 or 6 areas that need to be addressed? Where are there areas where people are really, where there are, significant, differences, or where people are really sort of, if you want to use the term, falling through the cracks?
Both local MLAs say they've talked to their health ministers about the potential meeting.
But as of now, on the Saskatchewan side, there is no timeline to actually get a summit up and coming here.
Well, as I say, I think Prairie North would be the obvious contact. They're the ones that provide healthcare in Lloydminster.
Anything that we think will improve patient access to healthcare or healthcare information or services is something that we are supportive of.
As far as a healthcare summit, I can't give a date or a time at this point. It is something that we're working towards.
But the city is optimistic a health summit can take place in the next year. And making strides towards this bi-provincial cooperation can even lay the framework for cross-country health care.
Lloydminster could be a leader in taking a look at how we can share health information across provincial borders.
But for Prairie North,
at the end of the day, the focus needs to be on our best family and patient-centered care possible.
But after hours of retesting that almost cost him his life, that's quality of care Erwin Elliott isn't satisfied with.
Well, it doesn't make you feel too happy. How many times is that happening to different people? It's very simple.
And a tough pill to swallow for the Semitats.
It's not good. They're saying how, they're making such good strides toward better health care. Well, we have yet to see it.
Over the past half hour, we've only scratched the surface of healthcare issues here in Lloydminster, from border barriers to subpar service to simply not having enough doctors. These are some of the problems you face every day. A health summit is in the works to solve those problems, but it takes a push from you to make something actually happen. Working towards better healthcare and a better Lloydminster. Thanks so much for watching Healthcare Uncovered.